So if I'm healthy, I'm young, that's really not a whole lot of comorbidities, not a whole lot of issues in terms of COVID generally, why should I get vaccinated?
So I think the most important thing to get across to young people who, for the most part, are less at risk of severe consequences of the COVID, is that we want to convince them that they can be either mildly symptomatic or asymptomatic vectors of the virus. And by a vector, we mean something that can carry it and be a contagion to something else or someone else, a loved one. So if you lived in isolation and weren't around your friends, your family, your grandma or your grandpa, or you never visited someone over the age of 65, then you might be able to isolate yourself. But we don't live in an isolated world. We live in a very social world. We're very social people. And the concern I have, the one I've tried to get across to our young folks in particular, is that we want to help protect your grandma in the nursing home when you go visit her. Or if you work in a nursing home or hospital, we want to protect the people that you're trying to take care of by getting you to a point of immunity so that you no longer can be a vector.
That's very important, Kevin. The number one reason to get vaccinated is protect yourself, okay? Even young people, they may have milder symptoms, but that's still, you're sick, even if for 3 days, okay? It may be comparable to a flu for a younger person, which if you've ever had the flu, it feels like a truck hit you. High fever, you're achy, you're down. You don't want to leave your couch, okay? And then what we've seen through this pandemic is if you're sick with COVID, you shouldn't leave your couch. You can't go to work. You shouldn't be out in public because we don't want those people spreading it, okay? If they don't get any severe consequences, yes, they get over it. But they're still out of work for 10 days in quarantine period. So that's, if we can protect ourselves from that, even the younger people who are less likely to die. But again, it's very important to protect those around us and loved ones. Hence the quarantine period we've all known to hope it doesn't happen to us. Mm-hmm. And the other reason for young people to get vaccinated is when you're vaccinated, if you are alerted that you've been exposed to someone who has had COVID, that quarantine period doesn't have to happen. You can feel safe that you're protected and you can still be out in public, you can still go to work, you can still be around people without having to spread that. And that's actually important. I know school's ending now, but through the summer, and hopefully we can end this pandemic by the fall if enough people get vaccinated. But now we have a vaccine that has been approved to administer to individuals 12 and up. And those are generally our middle school and high school age group. Both of my children have been vaccinated, and that was their choice. And one of the reasons they're involved in sports and activities, they did not want to risk having to be exposed to someone who had COVID and then have to be out of their sport or their activities or miss school events because they were home in quarantine. And the CDC recommendations are if we're fully vaccinated, we don't have to be quarantined. We're safe. That's very important for young people, especially that younger age group that's in school.
And that's a really important point for employers to understand, because I was confused when I heard Governor DeWine was dropping all the health orders, next week. I think it's June 2nd. And I just thought that meant things like contact tracing and quarantine, and all that was going away. But that's not going away. There's still going to be contact tracing. You could still be quarantined, if you're exposed to someone with COVID. And a lot of the government programs for like quarantine pay, they're going away, like they're expiring. So you could end up in a situation with 10 days off of work, unpaid, because these quarantine programs have gone away. So it's just something to keep in mind. If you're fully vaccinated, that's just another thing you don't have to worry about.
That's a great point. So with any vaccination, there's still a risk of getting the disease, but if we do, it's going to be a much milder form because our body can already recognize that virus and attack it harder. 95% efficacy is outstanding. I don't think we've ever had a vaccine in this country or world that's been showing data of 95% efficacious in preventing the disease, the virus or bacteria that's designed to prevent.